3 of the 5 medications I am about to discuss require no prescription at all. You can walk into any pharmacy today and purchase them directly off the shelf. And that is precisely what makes them so dangerous for anyone over the age of 70. When something is that simple to obtain, we stop thinking of it as a drug. We assume it is harmless. But for a body that has passed the threshold of 70, that assumption can be the difference between living independently and ending up in a hospital bed. Here is something most physicians do not explain clearly enough during a standard 15-minute appointment. After 70, the human body processes medications in a fundamentally different way. Your kidneys filter drugs from the bloodstream more slowly. Your liver breaks down compounds at a fraction of the rate it managed 2 decades ago. Your brain becomes significantly more sensitive to sedatives and anticholinergic substances. A dose that was perfectly safe for you at 55 can now cause falls, memory problems, kidney damage, and cognitive decline that is frequently mistaken for early Alzheimer's disease. I am Dr. Thomas. Today, I will walk you through 5 specific medications that illustrate this problem more clearly than any others. All 5 appear on the American Geriatric Society's Beers criteria, the medically reviewed, regularly updated list of drugs considered potentially inappropriate for older adults. This is not alternative medicine. It is mainstream geriatrics, finally reaching the people who need it most. Stay with me, because what I cover in the second half of this video may be the most important medication information you have ever received. Medication 1. Benzodiazepines. The first category is benzodiazepines. You likely recognize the brand names more readily than the drug class itself. Xanax, Valium, Ativan, Klonopin. These are prescribed primarily for anxiety and insomnia, and in the short term, they do produce results. That effectiveness is part of why they are so widely used, and part of why they are so consistently problematic for older adults. After 70, the brain's sensitivity to benzodiazepines changes considerably. Because the liver metabolizes these drugs more slowly with age, they build up in the body over time. A dose intended to help you sleep at 10 in the evening may still be impairing your coordination and balance when you get up at 3 in the morning for a glass of water. Multiple systematic reviews confirm that benzodiazepine use is associated with a substantially increased risk of serious falls in older adults, falls severe enough to require hospitalization. Falls are the leading cause of fatal injury in adults over 65 in the United States. This is not a minor side effect buried in small print. Beyond fall risk, benzodiazepines consistently impair memory, attention, and executive function in older adults, even in individuals who feel they have adjusted to the medication over time. The American Geriatric Society explicitly lists the entire benzodiazepine class on the Beers criteria as drugs to avoid in older adults. If you are currently prescribed Xanax, Ativan, Valium, or Klonopin, please do not stop taking it suddenly. Abrupt discontinuation can cause serious withdrawal effects, including seizures. This is a conversation to have with your doctor about a carefully supervised, gradual taper. I will tell you exactly what to bring to that appointment in just a few minutes. Comment below right now. Are you or someone in your family currently taking any of the medications I have mentioned? I want to understand how widespread this issue actually is among the people watching this video. Medication 2. Diphenhydramine, Benadryl/sleep aids. The second medication genuinely surprises people when they hear it, because it costs around $6 at any drugstore. Diphenhydramine, sold as Benadryl for allergies, and as the active sleep ingredient in Ziziquil, Unisom, and Tylenol PM. Millions of older adults take this every single night, confident that because it requires no prescription, it must be safe. After 70, it is not safe, not for regular, ongoing use. Diphenhydramine is one of the most potent anticholinergic drugs available without a prescription. Anticholinergic means it blocks acetylcholine, the primary neurotransmitter your brain relies on for memory and learning. Interfering with that chemical nightly for months or years carries serious, well-documented consequences. A landmark prospective cohort study published in JAMA Internal Medicine in 2015 followed 3,434 adults aged 65 and older for more than 7 years. Researchers found a clear dose-response relationship between cumulative anticholinergic drug use and dementia risk. Those in the highest use category had a 54% greater risk of developing dementia compared to non-users. The most common anticholinergic drugs identified in that study were first-generation antihistamines, exactly like diphenhydramine. A 2019 study in JAMA Internal Medicine, examining nearly 60,000 dementia patients, supported those findings. The evidence has continued to grow every year since. Margaret was 72 and had been taking 2 Benadryl tablets every night for nearly 5 years. Her own doctor had actually suggested it for sleep. Over those years, her family noticed she was becoming increasingly forgetful. Repeated questions, confusion in familiar places, words lost mid-sentence. A new geriatrician reviewed her medication list and flagged the diphenhydramine immediately. Over the 7 months following her supervised discontinuation, Margaret's cognitive test scores stabilized and partially improved. Her daughter described it as getting a piece of her mother back. The change was visible to everyone around her. Medication 3, ibuprofen and naproxen, NSAIDs. The next medication is one that tens of millions of older adults reach for the moment their knees or back flare up. And the kidney damage it causes develops silently, without a single noticeable symptom, until it is already well advanced. The third medication is ibuprofen and naproxen, sold as Advil, Motrin, and Aleve. These non-steroidal anti-inflammatory drugs are the default response to pain in most households. For occasional use in younger adults, they are generally manageable. For regular use in adults over 70, the risk profile shifts entirely. Your kidneys are responsible for filtering these drugs from the bloodstream. After 70, kidney function has typically declined by 40 to 50% compared to early adulthood. When ibuprofen circulates in a body with already reduced kidney capacity, it remains in the system far longer, causes greater stress, and progressively damages the very tissue responsible for clearing it. The 2023 update to the American Geriatric Society Beers criteria specifically reinforced the importance of kidney function-based dose adjustments for NSAIDs, recognizing how frequently this drug class causes acute kidney injury in older adults. The gastrointestinal risk is equally serious. The stomach lining becomes more fragile with age, and NSAIDs directly weaken its protective barrier. According to the NIH, older adults who use NSAIDs regularly are 3 to 5 times more likely to experience a serious gastrointestinal bleed than younger users, and those bleeds are significantly more dangerous in someone over 70. For anyone living with heart disease or high blood pressure, NSAIDs also raise blood pressure and increase fluid retention, elevating the risk of heart failure. That combination of kidney damage, gastrointestinal bleeding risk, and cardiovascular strain is exactly why ibuprofen and naproxen used as a daily or near-daily habit after 70 is so consistently flagged by geriatric specialists. Tell me in the comments, do you currently use ibuprofen or naproxen for pain? Yes or no? Because I am going to tell you what works better for joint pain in older adults, without any of these risks, coming up shortly. If this video is giving you information you have never received during a doctor's appointment, please take a moment to like it and subscribe. I publish honest, research-based health guidance for people over 60 every single week. We still have 2 more medications and a complete action plan to cover. Stay with me. Medication 4, zolpidem, Ambien. The 4th medication is prescribed to roughly 10 million Americans each year for sleep. Zolpidem, sold as Ambien. The FDA issued a specific safety communication regarding this drug in older adults, noting that elderly patients can carry far higher concentrations of zolpidem in their bloodstream the morning after taking it, compared to younger users taking the exact same dose. This means they are still pharmacologically sedated when they wake up, without realizing it. They feel like themselves. They do not feel impaired, but their coordination and reaction time are measurably compromised. Research consistently shows that zolpidem use is associated with nearly twice the risk of hip fracture in older adults. Hip fractures in adults over 70 carry a 1-year mortality rate of 20 to 30%. That means up to 3 in 10 seniors who sustain a hip fracture may not survive to the following year, often due to complications such as blood clots or pneumonia during recovery. There is an additional concern that is rarely discussed. Zolpidem suppresses the deep, restorative stages of sleep while increasing lighter sleep stages. You fall asleep more quickly, but you wake up feeling less restored. That drives continued use, higher doses, and dependency. The drug resolves nothing. It simply changes the shape of the problem. Medication 5. Proton pump inhibitors, PPIs. The fifth medication surprises more people than any other on this list. Proton pump inhibitors, omeprazole, Prilosec, Nexium, Prevacid. These are among the most widely prescribed drugs in the world. For short-term use of 4 to 8 weeks, they are appropriate and effective for acid reflux and stomach ulcers. The problem is that most older adults are not taking them for 8 weeks. They have been on them for years, sometimes decades, without any reassessment of whether they still need them. Long-term PPI use after 70 quietly depletes 2 critical nutrients. First, vitamin B12. Your stomach acid is essential for absorbing B12 from food. Suppress that acid for years, and B12 absorption drops sharply. Research published in JAMA found that long-term PPI use was associated with a 65% higher risk of B12 deficiency. In older adults, severe B12 deficiency causes peripheral neuropathy, the tingling and numbness in the hands and feet, as well as cognitive decline that closely resembles dementia. Second, magnesium. The FDA issued a specific safety communication warning about dangerously low magnesium levels in long-term PPI users. Low magnesium affects heart rhythm and nerve signaling in ways that compound both cardiac and neurological risks in older adults. Robert was 77. He had been on omeprazole for 9 years, originally prescribed for an ulcer that had fully resolved long before. He had been living with severe foot numbness and what his family described as a mental fog he simply could not shake. His B12 level came back critically low. His geriatrician tapered him off the PPI over 8 weeks, began aggressive B12 replacement therapy, and transitioned his reflux management to dietary changes and a safer medication alternative. For months later, his neurological symptoms were clearly and measurably improving. 9 years on a prescription that was no longer necessary, identified and resolved with one thorough medication review. Action plan here is exactly what to do after watching this video. First, write down every medication you take, prescription and over-the-counter. Yes, that includes the Benadryl, the Advil, and the omeprazole. Over-the-counter does not mean safe. Every substance that changes how your body functions is a medication and deserves the same level of scrutiny. Second, bring that complete list to your doctor and specifically request a geriatric medication review, asking for an evaluation against the American Geriatric Society Beers criteria. Those exact words will be immediately recognized by any physician familiar with senior care. Third, for pain management, ask your doctor about acetaminophen as a first-line alternative. It is significantly safer for both the kidneys and the gastrointestinal tract in older adults when used at the correct dose. No more than 3,000 milligrams total per day for adults over 65. Fourth, for sleep, ask for a referral to cognitive behavioral therapy for insomnia, known as CBTI. Studies consistently show it outperforms every sleep medication for long-term outcomes, with 0 drug interactions, no dependency risk, and no morning impairment. It is the gold standard treatment for chronic insomnia, and it works. Fifth, if you have been on a proton pump inhibitor for more than 6 months, ask your doctor directly whether you still require it, and whether your vitamin B12 level has been checked recently. Closing and safety, note one important safety note before we close. Do not stop any prescription medication without first speaking to your doctor. Benzodiazepine withdrawal without medical supervision can cause life-threatening seizures. For anyone managing heart disease, kidney disease, or multiple prescriptions simultaneously, any medication change requires careful, coordinated medical oversight. These 5 medications are not automatically harmful in every situation. But in adults over 70, used long-term without reassessment, the research is consistent. Your body has changed significantly since you first began some of these drugs. Your medication list may need to reflect that reality. Leave a comment below with one of 3 things. Write, reviewing my list, if you plan to check your medications today. Write your age and which of these 5 you want to raise with your doctor at your next appointment. Or write, sharing this, if you are sending it to a parent, a spouse, or someone else who needs this information. Please share this video with one person over 70 in your life, not for the views, but because this information could genuinely protect them. And subscribe if you have not already. Every week, I bring you honest, research-based guidance on the health decisions that matter most after 60. I am Dr. Thomas. You deserve to know what is in your medicine cabinet and what it is doing to your body. Now you do. I will see you in the next one.